Good morning, everyone. So, today's topic of discussion is dengue fever. Dengue fever, also known as breakbone fever, is an infectious tropical disease caused by dengue virus. Dengue virus is the most common arbovirus prevalent in our country, and it has four serotypes, that is dengue 1, dengue 2, dengue 3, and dengue 4. The vector responsible for dengue virus transmission is a female mosquito, that is Aedes aegypti, and also it is transmitted by Aedes albopictus. They are also known as tiger mosquito because of presence of black and white stripes over its body and legs, and it is a daytime feeder. This diagram shows us the transmission of dengue virus between the mosquito and the human. When an uninfected mosquito bites a human on the first 5 days of his fever, then it gets this dengue virus through the blood meal. This dengue virus gets transported from the gut of the mosquito to its salivary gland on the 12th day, and then that mosquito becomes ready for transmission of dengue virus between the other healthy humans. The most worrisome thing is that the dengue virus shows trans-ovarian transmission through the mosquito progeny, which leads to very high number of dengue fever cases during the post-monsoon season. This diagram depicts us the two most important pathophysiological mechanisms responsible for the clinical manifestation of the dengue fever. Those are vasculopathy, which leads to capillary leak and third space loss, leading to pleural effusion, ascites, and dengue shock syndrome. And the second mechanism is coagulopathy, which leads to bleeding manifestation of the dengue fever and can cause dengue hemorrhagic fever. The WHO classified dengue fever into three groups in 2009, that is a probable dengue, dengue with warning signs, and severe dengue. The 7 warning signs are very important to know because these have to be assessed in any dengue fever cases, and if these signs are positive, the patient has to be admitted in hospital and closely monitored. This image shows us the tourniquet test, which is done in dengue fever to assess for the assessment of thrombocytopenia and capillary fragility. Here in this test, we can see the petechiae are present in the 2.5 centimeter square and their number are more than 10. So we label this test as positive tourniquet test. This is the clinical course of the dengue fever, which has three phases: the febrile phase, critical phase, and recovery phase. The critical phase is present on the 4th and 5th day of the fever and is characterized by increasing hematocrit, decreasing platelet count, and the patient is predisposed to the maximum amount of capillary leak in this phase, and the patient can land up in dengue shock syndrome or bleeding related to dengue fever. To diagnose dengue fever, we have two important tests, that is dengue NS1 antigen test and the dengue IgM antibodies. For the first 5 days of fever, we should send dengue NS1 antigen because it is detectable in the blood. But after 5th day of the fever, the dengue NS1 becomes undetectable and the level of dengue IgM antibodies start rising. Dengue IgM antibody test is quite sensitive and it is done by using MAC ELISA, that is IgM capture ELISA. For the management of dengue fever, we categorize dengue as mild dengue, moderate dengue, and severe dengue. Mild dengue can be managed at home. Moderate dengue needs hospitalization and close monitoring. Severe dengue need to be managed at a tertiary care center in ICU setting. So the management of dengue fever revolves around three things, that is hydration in the form of oral hydration and IV hydration. Second is vitals monitoring, that is monitoring of patient's pulse rate, blood pressure, respiratory rate, and saturation. And third is monitoring of lab parameters, that is monitoring of patient's hematocrit values and the platelet counts. This is for today. Thank you.